Everybody good? Thumbs up all around? Alrighty, good morning and thank you all for being here today. Before I take your questions, I would first like to say some words about the importance of health in Baltimore City, as well as discuss the senior leadership who will continue to guide our city's progress in becoming a healthier city. As many of you know, a key goal of my administration is to grow Baltimore by 10,000 families over the next decade. And in order to grow a city, you have to both attract new residents, but most importantly, you have to give those residents who are already here more reasons to stay. And that means we have to continue to focus on driving key innovations and reforms necessary to make Baltimore a healthier place for residents, both new and old. And that's new residents and old residents, not like, long-time residents, not old residents. Never mind. While we have made progress, too many Baltimore City residents lack access to quality health care. Alcohol and substance abuse still plague too many of our communities, and health disparities continue to tell the story of two Baltimores, where race, income, and neighborhood can determine who lives longer and who lives a healthier life. I've never been a mayor who grows complacent and satisfied with the status quo. I pride myself on being a mayor who means what she says, and this is a top priority for my administration, to aggressively tackle systemic problems that lead to many unhealthy communities. We can break not only the cycles of poverty, but the cycles of poor health that we have and neglect in our city. And my partner for moving forward in these efforts will be Dr. Lena Nguyen, who I expect the City Council to confirm as their new health commissioner in just a few days. Dr. Nguyen is already hard at work and will begin a full schedule with the health department tomorrow. I have to say that she's already been on the job, and she doesn't even officially start until tomorrow. So, she'll be good, and she's already been good for nothing since she's not officially on the payroll. We look forward to your thoughtful, patient-driven approach that will help us ensure that Baltimore's residents will have the knowledge and access they need to realize healthier lives. Let me also offer my sincere thanks and humble gratitude for the service of Dr. Duval Harvey. She has done a yeoman's job as interim health commissioner. She has performed these duties with professionalism and with a passion for service, and I am so grateful for to have you on my team and to have you working on behalf of Baltimore's residents. So thank you. I would like to congratulate her on her new role at the Mayor's Office of Human Services, where I am confident that she will continue her track record of success to support our city's most vulnerable residents. This is an important job, and this is a position that I know that she will take the same leadership and passion for our vulnerable residents and shepherd this office into the future. And I would also like to thank Olivia Farrow for her long tenure as a director of the Mayor's Office of Human Services. I wish her the best of luck as her new role of everything old is new again. As I can't even call it your new role, your new and old role as Deputy Health Commissioner for Youth Wellness and Community Health. One of Dr. Nguyen's top priorities. Olivia is not new to any of us, and she came from the health department where her focus was on youth wellness and community health. And as this is one of Dr. Nguyen's top priorities, I can't even express to you the excitement that Dr. Nguyen shared with me about Ms. Farrow rejoining the health department and joining her team. Dr. Nguyen, your tenacious passion for creating safer and more transparent health systems is exactly the type of leadership that I want to guide Baltimore's health department. From your experience as Director of Patient-Centered Care Research at George Washington University, to your work to increase transparency in healthcare as the founding director of Who's My Doctor campaign, you have always been a patient-first doctor. Under your leadership, I am confident that Baltimore can become a patient-first city. As a medical student, Dr. Nguyen saw the disconnect between patient needs and healthcare providers. and she helped her mother navigate the medical system after her breast cancer diagnosis. Her dedication to transforming the healthcare system through patient advocacy and provider reform has led her across the country, from her childhood in Compton and East LA to Washington University School of Medicine in St. Louis, and to Harvard Medical School as a clinical fellow, and to University of Oxford as a Rhodes Scholar. Now an internationally renowned physician and patient advocate, I am confident that Dr. Nguyen will help us to continue the transformative changes already underway within the Baltimore City Health Department. Already, if you thought, that Dr. Nguyen, when you tell your story, and I don't know how much you're going to get into it today, you were probably described as an overachiever, and certainly an early achiever. And sometimes, people can burn out and leave all of that, and reach their peak very early. I will say that your drive to achieve continues to grow with every year. She has already outlined an ambitious agenda, which includes a listening tour of community organizations. I don't know if there are any left. I heard you met with everybody. So she will have a listening tour for community organizations, faith groups, hospitals, and other stakeholders to decide how to best address the 3 priority areas. Let me say that again. Dr. Nguyen has already started meeting with community stakeholders and hospitals and groups. Why? Because as a physician who's focused on patient first, it's very clear that you understand you can't start until you hear from the people that you serve. So it's not only what you talk about, it is what you've demonstrated, and I certainly appreciate that. She will detail that in a moment. Together, I know that we will empower, promote, and protect the health of all Baltimoreans. Again, I am truly honored to welcome our new health commissioner, Dr. Lena Nguyen, to Baltimore. Dr. Nguyen.
Thank you very much for the extremely kind remarks, Mayor Rawlings-Blake, and thank you all for being here as well. I am so honored and excited to be joining Mayor Rawlings-Blake's administration. As a physician and as a public health professor, I am so proud to work for a mayor who cares deeply about the health of our constituents and who really understands that health is so closely tied to all of our social priorities. We have our work cut out for us. As Mayor Rawlings-Blake said, we are living in a world of 2 Baltimores. Just like other major urban cities, there are hard problems like poverty, drug abuse, and disparities that contribute to poor health. These are hard problems, but we are not a city that takes a back seat to public health. We tackle the problems head on with solutions that are based on evidence and that engage our communities as equal partners. In the next 100 days, I plan to focus on 3 critical issues: youth wellness, substance abuse, and population health. First, with youth wellness, we all know that we need our children to be healthy in order to grow and to learn. This means having better asthma treatment plans to prevent kids from missing school, improving dental care and vision care, addressing trauma and mental health, and focusing on youth wellness. All of this and more will be part of our comprehensive youth wellness campaign. Second, we have to tackle the epidemic of substance abuse. The other day, I treated a patient in the ER, a young man, 17 years old, who had overdosed on heroin and wasn't breathing. We attempted to resuscitate him for nearly an hour before he died, and we couldn't save him. No one should die from an opioid overdose. This is a preventable and treatable condition. There is a cure for this deadly overdose that is safe and easy to use. We need to prevent overdose deaths. We also have to know and treat addiction as a chronic disease. And we have to improve access to drug treatment, to mental health services, and improve our connections with community resources. Third, we have an obligation as a society and as a city to help those who are most in need. On behalf of the health department, I commit to working with our partners in academic centers, federally qualified health centers, and community organizations to find innovative ways to improve our health systems. The Affordable Care Act gives many opportunities to improve access to care. We will also increase our efforts to help our older adults. 25% of our seniors who fall and break their hips will die within a year. Many will never walk again and will never live independently again. Let's work to prevent these falls from happening in the first place. Over the next 100 years, as our mayor outlined, I will be starting a listening tour with community members so that I understand their biggest concerns and how to best address them. I'll also be volunteering in our local emergency rooms and in our clinics so that I can see the health needs myself. And I'll be reaching out to community activists, religious leaders, hospital representatives, universities, foundations, and businesses. I want to thank the mayor for the opportunity to serve. Baltimore's health department is the oldest in the country and has a long history of innovation and over 1,000 employees who work hard every day. I have the great fortune of working with many extremely talented, committed, and experienced leaders, following in the footsteps of many amazing public health leaders, including Dr. Duval Harvey. And now I am so excited to welcome back Ms. Olivia Farrow back to the health department. She will bring her experience and her expertise to help us in accomplishing our vision. I look forward to working with Olivia, working with our senior team, under the guidance and leadership of Deputy Mayor Kierstater, Mayor Rawlings-Blake, to fight for our residents, to improve their health, and to tackle these hard problems of disparities and health inequity. How long you live should not depend on your zip code. Geography should not determine your destiny. We in Baltimore do not take a back seat to public health. I look forward to working with all of you and to answer your questions. Thank you.
All right, I will open it up to questions. Any Dr. Nguyen questions?
Sure, awesome. You talked about substance abuse. What kind of programs? I mean, the city's heavily reliant upon methadone, at least for opiate treatments, as you brought up. But there are alternative treatments that have proved, I think, more effective. What's your opinion on methadone as a treatment, or some alternative treatments, or what the city's spending money on thus far?
We in the health department work very closely with Baltimore Health, or with Behavioral Health System Baltimore, and with our partners both in the government sector as well as in the private sector on a number of methods. We need a combination of methods to address substance abuse. So first thing, and most importantly, we have to address substance abuse and addiction as a chronic disease. And we have to recognize that just like chronic diseases, that it takes time, that we cannot expect an immediate recovery, and also that relapses will happen. And just like chronic diseases, we have to address substance abuse with a multi-pronged approach. That includes drug treatment with methadone and buprenorphine. That also includes addressing mental health and behavioral health needs, and also includes incorporating social services and community resources. And I commit to addressing substance abuse using a combination of these approaches to best help our residents.
Any other questions for Dr. Nguyen? All right, again, I want to thank you all and welcome.
Thank you.
All right.
With today being the first day of the legislative session, could you lay out some of your priorities?
So many. This is the new day of the first day of a new legislative session is always a day of, just like the new year, it's a day of new beginnings, and it is about to be usher in a new administration. My goal for this legislative session is to continue the progress that we've made with capital funding for our schools, as well as protect the infrastructure investments that we continue to need to make in our transportation system. We have done a lot of work in Baltimore, laying the groundwork for next generation intermodal transportation with the Red Line, and I'm going to continue to advocate for that, as well as to continue to get the support and investment that we need in the state to continue the work that we're doing around providing affordable housing and addressing our vacant housing issues in Baltimore. So those are just some of them.
I asked you the question some months ago before the election about Plan B. Ken Ullman mentioned to the Business Journal maybe we should start thinking about rapid bus transit I don't think it's clear that what the governor-elect is gonna do on the purple and red line, but is anyone in city government working on an alternative to help achieve a more comprehensive transit system? We all know that it's been kind of an all or nothing proposition with the red line. And, you know, considering what's gone on politically, is anyone now starting to think about what else can we do?
I think it's important to understand that there has to be an assessment of what the environment will be without the red line. I think that some people feel like if we don't invest, if that investment doesn't come, you know, those federal dollars will be able to be used for something else. Those state dollars will be able to be used for something else. That's not the case. And we have to figure out, you know, we have to get a better understanding of the lay of the land if the red line doesn't happen. That being said, my focus is, you know, leaving it all on the field. Like this is a battle and a fight to keep those resources in play, because I know what it means to the future of our city. Yes, for transportation, which I think is essential for a sustainable, growing, and thriving city, but also for the jobs that the red line represent, not only in construction jobs, but with the potential development along the route. So while, you know, there are many people that are thinking about, you know, a plan B, my focus is on making sure that we protect the investment, because if we miss out on this more than $900 million investment from the federal government, as I was saying to someone earlier this week, it's not like if you're at the supermarket and you let somebody get in front of you and then you're next. We're not next. We're not next in line for those resources. We're at the end of the line, and that means that we will unlikely see that type of investment come to the city in you know, in our lifetime.
You in terms of specific proposals, yesterday you testified about, you know, police community. What do you have specifically planned for Annapolis in terms of police reform, which has been, of course,
we are still taking a look at the proposals of the legislature. You know, for me, it's I'm very results driven, and we know that we need greater accountability. We have exceptional officers, men and women who put their lives on the line every single day they show up for work. And as much as having bad officers on the street impacts the trust and the ability to work with the community, it puts those officers who are doing the right thing for the right reasons at risk as well. So I know that they are equally as concerned about making sure that that we deal justly and transparently with bad actors that wear the uniform. So, you know, we are still talking. We've been in many meetings to make sure that what we propose and support will achieve the results that we want. You know, I'm very, and when I talk about being results driven, the goal isn't to make a splash in Annapolis because we tackled or talked about tackling a big issue. The results is to get the change we need to bring more transparency and accountability.
Do you have a specific proposal in mind to push on the issue of the law enforcement bill of rights?
We are taking a look at the different proposals that are out there. So there's not one specific proposal yet. We're you know, taking a look.
I think that what I've heard is that some of the proposals out there they kind of tweak at it, but what seems to be the consensus from those who want change, really substantial change, is that there has to be a way for an officer to be fired easier than exists now. So is there a proposal like that that would achieve that to your satisfaction?
Not yet.
How about the civilian review board? That has been talked about as well. Are you still examining that as well?
Definitely, and one of the things I hope we will get assistance through the work that we're doing with the COPS office is help with that as well. I mean, that's one of the things we talked about yesterday when I testified before the president's advisors, that that many cities are taking a look at best practices when it comes to civilian review boards, and while it's certainly taken longer than I would like, it's more important for me to get this right. So we are taking a look at it, and hopefully through this work that we'll be able to get a more impactful review board.
Can we switch it up?
Yeah.
Councilwoman Ricky Spector had an interesting charter amendment from Monday night, switching from the single members districts back to multi-members, which is a form you're very familiar with. Did you have a chance to look at it, and what are your thoughts?
Yeah, I certainly think it's an interesting piece of legislation. She raises some, I think when she talked about the bill and why she wanted to introduce it, she raised some very important issues. And while I haven't formed an opinion, I am taking a look at it, and I'm certainly waiting to weigh in with the council members when they. I'm sure we'll have discussions about it.
The comptroller raised some general questions about the audit process, but you answered it. Could you just reiterate some of your thoughts about what the contracting out of the audit process and how that conforms to the.
What specifically?
Well, specifically, the controller was saying, well, these audits should be conducted by the Department of Audits and not done by the executive branch because it presents a conflict of interest.
So that's what I would call settled law. The city council and I don't know who initially introduced the legislation, but the legislation was introduced to change the charter. There was a very public process about that, including opportunities for the comptroller and others who disagree or that felt any way about it to participate in that public process. I was very clear. It wasn't I didn't support it, but I heard from the council and I heard from the public when they overwhelmingly approved the charter amendment. Now it's up to us to make sure it's implemented. So to rehash that conversation about who or who shouldn't be conducting audits, I think is a waste of time because the people have spoken. The legislation was very clear that the public wanted not just the comptroller's office to perform the audits, but also to engage outside auditors. And we have worked not just with the comptroller's office, but also the city council president as a representative for the council to make sure that in the implementation of the charter amendment that we get it right. What was the spirit and the intent of the legislation, and we're committed to continue to move that forward.
One more question, or are we done?
It's been a pleasure. Happy birthday, Slick Rick.
Thank you.
Take care.
Minneapolis.
Okay.